Hey guys! So I'm going to go over the digestive system here pretty quickly. Normally, this is the body system that is the most interesting to people because you can actually visualize, wow, I'm eating this hamburger, and then kind of see it go through the different body parts. So as we go through this, think about what you've eaten last and try and visualize what it would look like going through your body. All right? Okay, so the digestive system consists of the organs that make up the alimentary canal. The digestive system performs these different functions. So, number one, it physically breaks down food into smaller pieces so that they can be digested and you can gain nutrients from them. It chemically breaks down food into fat, carbohydrates, and protein. So, if you think back to our nutrition unit, think about what all those different things are and what the percentage is that your body needs to be healthy. It absorbs nutrients into the blood for use in the body, and it helps maintain the proper amount of water, electrolytes, and other nutrients in the body, as well as eliminates waste. All right, the mouth. We all know what our mouth is, but we may not know exactly what is happening in your mouth when you are eating. So, food enters through the alimentary canal in the digestive system through the mouth, unless you have some disability where you can't eat through the mouth, and then you may have a tube that goes directly to your stomach, like in your belly area, or you may have a tube that feeds you through your nose. But for the most part, most people's nutrition, the food goes directly to their mouth. All right, the mouth is also known as the oral cavity, which we all should already know by now. So basically, the teeth begin the physical breakdown of the food by chewing and grinding it. This chewing process is known as mastification. So mastification is literally just chewing. It's a fancy word for chewing. At the time of your chewing, there's 3 different pairs of salivary glands that secrete saliva to mix with the food. After the food is chewed and mixed with saliva, it is known as bolus. Saliva contains enzymes that begin the chemical breakdown of the food. So basically, your saliva mixes with the food and it starts chemically breaking down that food and it turns it into something called bolus. So saliva is what causes your food to truly break down after it has been physically grinded by your teeth. All right, so now we're going to move on to your throat, which is called your pharynx. The pharynx, as we know from the last section, the respiratory section, it carries air, but it can also carry food. This should be review from the last section, but the epiglottis is the flap that basically just protects your airway so that you don't have food going into the air passage because that can cause you to choke. All right, the esophagus. So the esophagus is a muscular tube that carries the bolus to the stomach in a slow wave-like motion. So remember, bolus is the food that has been physically and chemically broken down. Peristalsis is the wave of contraction by which food is moved through the rest of the digestive system. So if you see, it goes down to your esophagus, and then from there, the muscles are kind of just pushing it through in a slow motion so that it can get down to the rest of the digestive tract. All right, so next we have your stomach, which we think like, ooh, all my food goes directly into my stomach, but now we kind of have an idea that it's much more complex than just going directly to your stomach like a snap of a finger. All right, so the stomach is a sac-like muscular organ that receives the bolus from the esophagus. The cardiac sphincter is a valve that controls the entrance to the stomach and prevents backflow from the esophagus. So basically prevents you from just throwing it back up. The stomach environment is highly acidic, so a layer of mucus along the inner walls of the stomach is very, very important to protect its lining. In the stomach, the process of maceration it occurs when the bolus mixes with different gastric juices and the highly acidic liquids, and it forms something called chyme. So chyme is the pulpy acidic fluid that passes from the stomach to the small intestine, consisting of gastric juices and partly digested food. So the food isn't fully digested at this point. Then we have the pyloric sphincter, which releases chyme into the small intestine after about 1 to 4 hours. So I want you guys to write down so you have kind of a timeline of when all of this stuff is occurring. So the chyme is released into the small intestine anywhere between 1 and 4 hours, depending on how quickly your digestive system is working and what you've eaten. All right, so the small intestine is the next step. Most of the digestive products pass into the bloodstream in the small intestine. Digestion is completed in the small intestine, and next the chyme passes into the large intestine. All right, so in addition to chyme from the stomach, the small intestine receives bile from the liver and other pancreatic juices from the pancreas. The small intestine is a pretty large thing because it has 3 different sections. So that might be a little confusing sometimes when you think small intestine, you're like, oh, it's just a small part, but really it is very complex. So the first section is the duodenum, is the first 10 to 12 inches of the small intestine. The jejunum is the middle section of the small intestine and is approximately 8 feet in length. And then the ileum is the last 12 feet of the small intestine, and it connects to the large intestine. So once it gets down to the ileum, you know that it's about to go to that next step of digestion next to the large intestine. All right, so as you probably could have guessed, the large intestine is the next area that we're going to be discussing. The large intestine is also divided into 3 different sections. So we have the cecum, the colon, and the rectum. All right, so first of all, most of the water from ingested food that is indigestible is absorbed back into the bloodstream in the large intestine. So you can think about that. Most of the water from ingested food that you can't really digest is absorbed back into the bloodstream in the large intestine. So that's where that's occurring. Not in the mouth, not in the stomach, but in the large intestine. All right, so E. coli is something that's very, very common. It's a bacteria that lives in the large intestine, and it helps to form feces out of the waste material. It also produces vitamin K for the body. So if you've ever heard of someone getting E. coli, it can be from feces particles that maybe were left on, I don't know, a toilet seat or something like that, and then somehow you touch it and it gets into your mouth, and then you can get E. coli, and it can make you very, very ill. All right, so the feces is collected in the rectum. Then they pass through the anal canal and are expelled at the opening called the anus in a process called defecation. Defecation is just a fancy word for pooping. So you have the waste material go to the rectum and then to the anus, which is your booty hole, and then defecation is when you are actually having a bowel movement. All right, moving on to accessory organs of the digestive system. There are 3 accessory organs that carry digestive juices to the digestive tract. These include different enzymes that protease to break down proteins, amylase to break down starches, and lipase to break down fats or lipids. The liver is the largest gland in the body, and it secretes bile to help digest fat. Bile is basically something that is going to break down fat and dissolve it in water so that it can actually be absorbed and utilized in the body. The liver also stores sugar in the form of glycogen and the fat-soluble vitamins, and it breaks down a lot of toxins taken into the body. So if you think about toxins such as alcohol, your liver is actually trying to clean that out and get rid of those toxins that are harmful to your body. So a lot of individuals that suffer from alcoholism have long-term liver problems because their liver is really being overworked. The next is the gallbladder, and it's next to the liver and receives a different bile from it. The gallbladder stores that bile until it's needed in the small intestine. You do not have to have your gallbladder in order to live. You can have your gallbladder taken out, but if you have your gallbladder taken out, it makes it kind of difficult to eat excess fatty foods because there's nowhere for that bile to go. All right, a few diseases and disorders of the digestive system. First off, we have an ulcer. An ulcer is an open sore on the lining of the digestive tract. Normally, the cause is from stress or some type of bacteria. And basically what it does is it increases the amount of stomach acid that your body's producing, and so it damages that lining of your digestive tract. Symptoms can include burning pain and having a very hard time digesting. Treatment involves antacids, reducing stress, and avoiding caffeine, alcohol, and tobacco. So really just avoiding things that make your body work harder. And if the ulcer is caused by bacteria, your doctor is likely going to prescribe you some antibiotics. All right, next, constipation. We have all probably been constipated at one time or another in our life. You are very, very, very uncomfortable. You just have like an overall sense of not feeling well. So basically it's when you are unable to have a bowel movement. The colon is absorbing too much water from the feces, which makes your feces very, very dry and hard to push out of your body. The condition can be caused by low fluid intake, lack of fiber, lack of exercise, or stress. Some medications can also cause you to be constipated. Symptoms include pain and pressure in the abdomen, and treatment involves drinking plenty of fluids, eating foods high in fiber. Your doctor may recommend that you take a laxative, which just helps you defecate much easier, but you don't want to take them too much because they can be very habit-forming and they can lead to long-term chronic constipation. Inflammatory bowel disease, which is commonly known as IBS, it includes Crohn's disease. Crohn's disease can occur anywhere in the digestive tract and affects every layer of tissue. Ulcerative colitis typically occurs in the colon and rectum and affects only the innermost layer of the tissue. The cause of IBD is not known, but emotions and stress can trigger symptoms. So it can kind of like affect you randomly, periodically, depending on what's going on in your life, or it can be something that's just very chronic, happening all the time. So most of the time you have chronic diarrhea, a lot of cramps, blood in the stool, weight loss, and fatigue. Most of the time treatment involves some type of anti-inflammatory medication, antibiotics. Major changes in your diet can be stressed to do, and then also trying just to keep yourself like very calm, not stressed, so that your body isn't triggered. Lastly, diarrhea, another thing we've all probably experienced. It's miserable. You feel like you have to go all the time. When you do go, your stool is very loose, watery, and this is something that's really common and not usually serious, but you can lose a lot of fluid when you have diarrhea. So it's very important that you are drinking lots of fluid, water, things that have electrolytes in it to make sure that you're staying healthy. Diarrhea can be usually treated over the counter with just basic medication. However, patients suffering from diarrhea may make sure to drink a lot of fluids so that it doesn't cause dehydration. All right, guys, it was great being on here again for just a little bit. If y'all have any questions, please feel free to reach out, and I'm always happy to help. I hope you're all doing well.